When a patient is ready for hospice, even before they're ready, I'm entertaining the suggestion of palliative care, which has nothing to do with hospice. So, palliative care is another avenue that a patient can have that just provides resources in the community for the patient and the family to have. So that palliative care program is going to check on the patient and see how they're doing, but they're also in tune with the disease progression as well. So they can give us an idea of whether they think that the patient is hospice appropriate. There are certain requirements for hospice. One of them typically is what everybody describes as that 6 months or less to live. That is a requirement. However, patients can live longer than 6 months and have lived longer than 6 months, and hospice doesn't kick you off when you've lived 7 months. Once you're on, you're on. But we want to make sure that the patient has everything in place before that happens too. So big ticket items like a power wheelchair, a feeding tube in place, those things that a patient needs to have, we want to make sure that they've got that on board before hospice takes over, because hospice is essentially footing the bill for the rest of the time that the patient is alive. And that's covered through Medicare for the patients, no cost to the patient, but hospice is incurring the costs. So we want to make sure that everything is taken care of beforehand. And then once they're on, everything is taken care of through hospice. There's a nurse that comes out, and the frequency of that nurse is determined by how the patient is doing. That nurse can recommend that a respiratory therapist comes out. The nurse can recommend a social worker coming out. The nurse can recommend a chaplain coming out. They can request a home health aide that comes out and helps with bathing or dressing or light housekeeping needs. All of those sorts of things are done with hospice. The best part about hospice, though, is that the patient and the family have 24-hour access to the nurse, and the nurse has 24-hour access to the doctor. So if there's a need at 2 a.m. on a Saturday, she can call the doctor and say, I need this drug for this patient, and she has it immediately. So that is very beneficial to the patient who might be struggling and to the family who's very anxious about what might be going on in the home at the time. Also, the other thing with hospice is there's always that situation where the patient may say, I'm really in distress and I want to go to the hospital, but I'm on hospice. And the patient can always make the decision to revoke that hospice benefit, go to the hospital if they need to. I just don't want patients to feel like I can never seek treatment again. If I really feel like I want to do that, they can revoke that hospice benefit and go to the hospital if they need to, and then re-enroll on hospice afterwards if that is a decision. So there are so many options for patients out there. I just want to make sure that they know all of their options and that they're not locked into one decision just because they made it. But hospice by far is one of the best decisions that a patient can make, and the sooner the better. The benefit from it is exceptional, and I've never ever had a patient say, I should have never chosen hospice. They always say, I should have done this long ago. Most of the care takes place in the home. Here in the state of Arizona, we have some inpatient facilities, and they're really just for temporary stays. So we may have a patient that's got some symptoms that are a little hard to control in the home. So we may take them to that inpatient facility for a couple days to get those symptoms under control, and then they move back into the home setting. There are some hospices in other states that have inpatient facilities that you can stay at, but most ALS patients prefer to stay at home, and most hospices offer home care. I can't think of a hospice that would not provide in-home services. That's generally what it's for. So, and most of our patients choose that option. There's virtually no pain associated with it. Lots of patients have a fear of that air hunger, anxiety associated with it, and that doesn't happen when hospice is on board. They are very good about making patients as comfortable as possible and making sure that there's no pain involved. So when we're getting to that stage in a patient's life and their disease, we are always suggesting that they go with hospice so that there is no problem with that. And it actually gives their family a comfort level too, to see that their loved one is not suffering at that time. So hospice is always an option and always a recommendation for ALS patients.